All right, people, so this is day 3 of my hormone intake. I know I'm a little bit late. I'm supposed to do it between 6 and 9 p.m., but I went out flying today. This is how this is my gonal. I take 250 of this, so I actually set it up for 250. These are stomach injections, so this is something I have to actually do on a daily basis until until I have actually my test on my ultrasound check. I have 3 ultrasound checks on a weekly basis and blood test. So that's actually going to determine how many eggs I have and what are my levels. So I also have menopause, which is actually hormones, and I actually take 150 of that versus 75. So I'm going to show you what I do. So these are the two. These are the powders, and these are the Saline, or sodium chloride. So yep, I have to dilute this in there. So I have this, take this out. So this is my intake of how I actually have to inject my hormones. I haven't had, for the past few days, with the hormones and all that, I've been having issues with headaches. My headaches have started yesterday, which is not good. But I mean, after I go ahead and just go to sleep, it actually just goes away, which is a good part. I mean, technically it's a good thing. I have plenty of syringes. They actually gave me lots of syringes just to go ahead and do that. But I actually have to have like the Saline. So I actually have to take 1 millimeter of Saline. Let me see here. Get out. So I do that from that one because sometimes make sure it doesn't have any bubbles. And then I just go ahead and just put this in here. Stir it like this. So it's really, really important. I do not use this needle to actually inject myself because I have other needles. So they're like the, how I say this? They are the insulin needles, which is better. And I have to do this twice. I'll show you. So this is one. The first day I did this I kind of freaked out because it was so many things that I had to put, and it was like a little bit overwhelming. And it was a lot of medication because it comes in a huge box, but at the same time, the videos don't tell you exactly what they are. You know, it's just like, oh yeah, you have to do this and this and this, but then again, what is what, and it's just like, okay, so if you have it this place, I mean, if I showed you what it is, most likely I'll show you. All right, so in this case, I have like a cap thing, right? I'm gonna show you this. These are the caps that it actually gives me to mix it up. But in this case, I can't use this cap because it's not 2 millimeters, right? It is 1 millimeter to dilute it and have, to mix this medication, right? So for me, it's just like if I go ahead and do that, oh, I forgot. I actually have to use this one. So they gave me 1 needle for this. So now I'm gonna take this because I wanna get as much as possible out of this because it's 150 millimeters of this. And because this is a thicker needle, it is actually easier to remove the content out of it. And I always have to make sure that doesn't have bubbles in it. So this is 75 and this is another one. So I have to make sure that I actually pull everything out of this completely. So I'm pulling it out, making sure that I have all the content in there. Okay, so I don't do the test. All right, so I go ahead and do this. Usually they say don't reuse needles, but in this case, I do have to reuse the needles just because they didn't give me enough needles for that. So I have the little needles now. And I know some of this is going to be a little bit graphic, so I already done left and right for my injections. So the following part is going to be a little bit grotesque. A lot of people can't deal with needles, but the needle is so thin, so don't worry about it, honestly. Like, the needle does not hurt at all. It's just like an insulin needle, and I'd actually have to clean myself. So, all right, so I have 2 of these. This one is $2.50, which I don't know, you can see that $2.50 there. And in this case, I'm not gonna put it like that, but I'm supposed to retrieve this. I'm just getting it ready. Yep, all right, so these are ready. Now I'm gonna, since I actually already did my left side and my right side, or my right side and my left side, so I'm gonna go ahead and put it here. And there's 6 places that you can actually put it. You can put it in your arm, your tummy, and your thigh. Left and right, tummy and thigh. So today I'm gonna put them in my thighs, just because it's not gonna be that graphic, and hopefully you guys don't throw up or anything. But if you guys have questions, just comment below and let me know what questions you guys have. I know this is a new process for a lot of people. So I'm just gonna go ahead and do it on my right side, so I just have to make sure that this is the needle. It's not thick, it's really, really thin. I don't know if you can see it. Let's see. All right, so this is the first time I actually inject myself in here with this. I just have to make sure that, and it starts going in completely. All right. So that's for that. I don't know if I'll be able to use this. So it goes down to 0. It stings a little bit, I'm not gonna lie, but now I actually have to put this back in the refrigerator. I'm not so sure what the doctor would want me to do with the rest, because it's tomorrow I have to have $2.50, and then I put this in my red container here. It's just a little sting, and then I just put this back in the fridge. Now I have my second one. Alcohol pads, very different. So I know I have a big mess here right now, but it's something I have to do. I like to just keep the same side, making sure like if both needles are going to, then the shots are going to the same side and so forth. So I'm just gonna do it on a different side. All right, that fell, but all right. So making sure that it doesn't have any bubbles. I already made sure about that. So no bubbles on that. It's a small needle too. I get a little bit nervous just because it kind of stings, but it doesn't hurt. So I just have to make sure that the whole needle is in there and all of it is in there completely, goes in there. Okay, that does sting a little bit. All right, so all of it went in there. Same thing. Go ahead and disperse the needle. So those are my treatments. See, they're empty. And then what I do is just throw these away, and I'm bleeding a little bit here, so I'll just clean it. I don't wear anything, so I mean, this one is a little bit inflamed just because, but I mean, it's just my hormones, whatever it is. But yeah, that is day 3 of my fertility, my hormone treatment for IVF. So my egg retrieval. So if you guys have any questions, anything, let me know. This is Cindy Pressgraves, and I hope you guys are learning from this journey. Have a beautiful day. Bye.